Do you like Dan or Daniel?
Daniel.
Daniel. Okay. My brother, my son's Daniel too. He likes Dan.
Okay, very good. Strong name.
Yeah, I try to call him Dan and he gets upset. No, it's Daniel, Dad. I'm like, I named you. I can change. But
That's funny.
so today I don't know if you've had a chance to watch any of these interviews or anything like that, but I just want you to share, like, imagine if we're talking to someone that's only been out for 3 or 4 years, and if you could go back and do it again, what would you do different? Like, you started out cold, like what worked for you, and what are the real big keys? Okay.
Yeah. So,
Let me start the intro here before you start talking.
Okay.
Okay. Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto and I have Dr. Daniel Hall here. Welcome to the show, Dan. Daniel.
Hey, thanks for having me, Don. I appreciate it.
You're welcome. So we're going to have people kind of listening. Other podiatrists been out a couple of years, 5, 10 years. What's really been working for you in your practice, and what worked in the beginning when you started cold?
It all started with having a solid foundation. I have the fortunate success to have my wife, who's also a podiatrist, practice with me. But we decided towards the end of our first year in residency, that we wanted to open up a practice. And it took about 2.5 years to kind of get all that settled up. And we actually acquired a practice in Lake Charles, Louisiana. And it was a rougher start than I thought. I get a lot of people that reach out to me and ask, how do I do this? How do I do that? And it all starts with a business plan. Any book you read as far as starting a business, and that's what this is. Medicine is a business. And I try to implore that on those that are coming up and looking to open a practice. But having a solid business plan and understanding the costs associated with it, and then how to obtain the money from banks, and then to go from X, Y, Z, and the fourth to get you to where you need to be. But ultimately, it was just preparation, I think, was our biggest key to success. We had the blueprint. I mean, we had a building, we had equipment, we had employees, we had all of those things kind of in place when we started. So we had a head start over just starting up cold, but preparation was the key. And then with social media and just being present and, just being involved in the community and the hospitals here and around town has really helped our practice flourish.
Yeah. So let's talk a little bit about that. Now, when you make the plan, did everything go according to the plan, or were there some hiccups?
Substantial hiccups. So the business plan itself was fine. It was the individuals that we purchased the practice from is where things kind of went south. When you first finish up residency, July 1st, that's when you can apply for insurances. And that insurance time frame to get on all the plans, it took a lot longer than we ever thought possible. Yeah. I mean, it took us almost 8 months to get on the business plan. So how we had our lawyers draw up the contract was we were going to bill under that previous LLC that we acquired, and they would come back and back sign to make sure everything followed through. Well, about 3 months into practice, all of a sudden they just stopped showing up. So they're not answering calls. They're not, what's going on? So I decided I'm just going to drive by their house. And when I tell you, Don, their house was empty, gone. They had moved back to Minnesota.
I'm from Minnesota.
Didn't tell me.
Really?
Or anything. So we're seeing patients, money's coming in to their account, and then they stop transferring the money to our account. So what do? Do you still see these patients? Well, of course you do, but money's not coming in. We've got our line of credit we're drawing from. I mean, $40,000, $50,000, $60,000 later, it was a lot. So that was probably the biggest stress that happened to us. And, of course, we go through litigation and all of that stuff. So, an unexpected surprise when we first started practice. That was probably the biggest hurdle. I'm like, if we can get through this,
you can get through anything.
Get through anything.
And I think it's getting through those first couple of years. And now, when you started, were you just? Let's talk about let's first talk about how do you get patients in the door? Were you busy enough for a 2-doctor practice, or did you have to do some stuff? I know you talked about billboards and social media. What's working really well for you, or what worked and what's working currently for you?
So what we did is I mean, we didn't have any money. We were broke residents. You remember those days. So I built our website on GoDaddy.com.
Yep.
And I put a little like online request button. So we were seeing patients request appointments and we weren't there yet. So we were actually getting patients for that doctor in hopes that they'd still be there. So our first day, I think we had 25 patients, 12 no-showed. And of the 13 that showed up, half of them had balances. So we just realized like, this is such a mess. We didn't really understand the business side of it. And that's something that no one can teach you. I mean, you can read all the books in the world. You can look at webinars, go to conferences, but until you get in there, until you're actually dealing with that, that was the first eye opener. But I tell you what really helped was social media. You know, Facebook wasn't as big, 7, 8 years ago when we started. Instagram was helpful, billboards. We live in a relatively small area, so people know who you are. And then really getting visible in the hospital setting. We were fortunate enough to have one hospital that really had no podiatry service. So general surgery, orthopedics, they were kind of handling the diabetic infections and some of the lower extremity fractures and such. And we were a welcomed addition to those areas, and just building those relationships and referral patterns. I mean, you gotta get out there, introduce yourself, go to meetings, call businesses, call doctors, primaries, internal medicine, and schedule appointments and try to just introduce yourself and hopefully establish a referral pattern. And we had some success with that.
Yeah, that's great. And now how about in terms of you got them into the office. Now, being in private practice versus working for a big group, has that allowed you to do certain things that you couldn't have done in a big group, like a hospital group or things like that? Like, can you be more creative with what you do? Or
Oh, absolutely. And a lot of my colleagues that I still keep in touch with today, a lot of them are in groups or hospital settings. So DME, first and foremost, that's huge. And not just boots and braces and things like that, but wound care products and grafts. And I mean, you just have so much flexibility when it comes to that. So that's probably the biggest advantage that we have being in private practice is DME is a big part of our practice, dispensing in office products and, offering services such as a laser therapy. I'd have to go to the hospital and say, hey, can you buy this $30,000 laser so I can do treatments that aren't covered by insurance? I think the CEO is not going to like that very much. But yes, private practice has just yielded us a tremendous amount of flexibility that we wouldn't have elsewhere.
I think, Daniel, what happens in the big places, they might want to do these things, but really they just either do surgical procedures or office consults. That's all you really do. Whereas we can do a lot of other things. So, I haven't really talked to too many people about wounds and especially DME for wounds. So are there a couple of things that are working really well for you right now in terms of reimbursing in the office? I know I did some dermagraft in the beginning, and now there's other ones. We have the Kerasis, and a lot of it is kind of getting it covered and actually not eating them. So any good thoughts about not eating them?
Yeah, so there are a couple of grafts out there that we're reimbursing well, but you just I find that the most helpful wound care product in our practice by far and away are the collagen wound care kits.
The Amerigel ones, right? Are those the Amerigel? Did they do those?
Amerigel, yes.
Yeah.
So there's the Amerigel kit and there's the Helix collagen powder. And I mean, the reimbursement on that can yield anywhere between $700 to $1,000 per month. You dispense it every 30 days for the wound. Has to be full thickness. It can't be a pressure ulcer. So there's certain kind of caveats that go with that. And then there are certain payers that do pay better than others. But the collagen dispensing kits just work fantastically. And, where we got the idea is I do a lot of patients that have home health care. So if they have home health, we can't do the in-office dispensing and things like that. But I was seeing what they were getting reimbursed for, Prisma or Hydrofera Blue or some of these dressings that they're providing our patients. And it's astronomical. So we decided, hey, can we link up with a company or group? And our practice consultant put us in touch with the Amerigel folks. And it's been wonderful.
Yeah. Yeah. Well, let's talk about that. So you have a practice consultant. How is that helping you?
You know,
Tell me
we
about
we
that.
probably got our practice consultant too late because we didn't think we could afford it. You know, it's almost like that old saying, like, if you can't afford college, you can't afford not to go to college. And we didn't know what we didn't know. So when we got our practice consultant, you know, she streamlined things. We have a pretty busy practice, but for some reason around like the 10 o'clock and the 2:30 slot, we were just getting bottlenecked. So slight twerks to the schedule on where to put new patients, where to put these walk-in fractures from urgent care, the ER. That was probably the biggest help. And then two, finding different vendors and dispensing and, oh, you guys should consider this is how I would advertise towards this section. So it's been wonderful as far as having a practice consultant. And I recommend any practice out there at least get a consultation to see, am I being effective the way we want to be effective?
I think that's great. You could call it a consultant, you can call it a coach, you can call it, well, whoever. But I think you just said something, Daniel. We don't know what we don't know,
Mm-hmm.
whether it be in surgery or other types of things, but especially in business, because we're not trained in business. And so unless you get so what else, what other types? So they kind of help with scheduling, they help with the collagen, any other kind of things that would help others that they
Yeah, so they put together, you know, the way it was actually a really interesting concept is that the consultant came in as a new patient and only we knew she was the patient. And she got to see from start to finish what the flow was like. She called, made an appointment, what that was like on the phone. And then she kind of gave us a review and said, hey, these are areas you're really strong at. These are areas that need a little bit of work. What does this person do? What does this person do? And why don't you have this person and this person? So not only did she kind of change some things as far as employee positions, but she also was able to figure out, okay, this personality works well with this person. This is how you should employ this person. Do you guys need an office manager? Do you not need an office manager? So it was very cool and unique how she came in and really kind of set the tone for what we needed. And we've been relying on her for the past 2.5 years. And I tell you, you know, COVID-19 is obviously a horrendous tragedy, but I think a lot of practices and hospitals learned where they can cut fat and where you can make some tweaks and do some things. So our patient volume went down, I'd say 20% from this year to the year prior, but our revenue went up 15%.
Yeah.
Because you're able to spend more time with patients. You know, you spend that extra 2 minutes, find out they're having some type of pain, you dispense something, orthotics, what have you, it increases your revenue cycle.
Wow. Yeah, I think other industries, they call it like the secret shopper. And for those that are listening, you could actually just have another colleague come visit you and put them in the schedule and have them watch the flow and
Yeah.
chat with them for the 20 minutes when you're in the treatment room.
Yeah.
You know, anything like that, or a spouse or anyone that's part of the family, do that same thing. Getting that feedback whenever I have someone that's in, I have some car dealership people that come in. And I always ask them because they're familiar with that. I'm like, hey, what was your experience like? Who was good? Who wasn't good? And getting that feedback and even just requesting it, because patients feel honored that you do that for them.
Yes. I ask, you know, all my colleagues, I say, hey, when's the last time you sat in your waiting room? And I had never sat in my waiting room at any point in time when I'm seeing patients. And to go sit out there and see, okay, you know what, the magazines are kind of in disarray and there are little things that you can tweak to just make the patient experience better. You know, always working on your practice is something that me and my wife continuously tell our employees and each other, that, you know, the second that you get comfortable is when, you know, bad things can start to happen.
Yeah. And then in terms of like between the two of you working together, how is it? Do you have like, I'm a very structured person. Like I do these calls on Wednesday, Thursday, Friday at noontime. You know, I have our office meetings at this time. Are you pretty structured about the way you guys work on the practice, or do you just kind of chat between patients, or do you have certain block time set aside to do stuff?
So she'll have her own schedule. I have my own schedule, and I've got my rooms and my MAs, and she's got her rooms and her MAs. So, you know, even as something as simple as a nail avulsion, we do different techniques, different things. So we are structured. So we're both in the office on Mondays and Wednesdays only. Tuesdays is my full OR day, and she's in the OR as well. And then she'll sometimes have Tuesday afternoon clinic. And then Thursday, I'm at 2 different wound care centers, and she's got the office to herself on Thursday. And then whatever Friday afternoon or morning comes up, either I'll do Friday. If, I've got a lot of inpatient from being on call the night before, she'll come and do the clinic. But Friday's kind of like a toss up between me or her in the office.
Yeah. So it sounds like a good kind of a balance. You're not doing the same thing every day. You're not going to get burnt out. It's a little bit of variety.
Oh, for sure. For sure. And it's funny because, we'll be here. Our offices are right next to each other, but we might not talk until lunchtime just because we're kind of doing our own thing, walking past each other. So it's very cool working with your spouse. I like to joke that she's my boss at home and at work. And that's kind of the mantra that we have here in the office. And it's fantastic. It really is.
Yeah. So what do you look at, Daniel, when you look in the future, in the next 2 or 3 years? What are things that you're excited about that you're seeing in the horizon for podiatry, things that really generate more revenue for your practice? Any thoughts out there that you think you'd like to add, you'd like to try, things like that?
2 things. One, I think podiatry has done an exceptional job, probably better than most other professions as far as keeping up with meaningful use and quality metrics and things like that. And, even you're seeing hospital contracts now. It was purely RVU based. Now it's going to be less RVU, more quality metrics that take place and take shape. So one, having an up-to-date EMR is going to be pivotal for any of us that still see mostly insured patients. 2, I think with the advancements of minimally invasive surgery kind of coming back into the fold is something that I think anyone who does foot and ankle surgery should at least be aware of and attend a course and see if that's something that fits their practice. Because as revenue or RVU reimbursement decreases, well, if I can do something more in the office versus going to the hospital or surgery center, that's going to be more revenue for our practice. And then thirdly, I think patients are starting to slowly realize that not everything is covered by insurance. Initially, it's, hey, if it's not covered by the insurance, this might not work. Well, there's laser therapy, there's amniotherapy, there's PRP, there's a lot of other, orthobiological procedures that can really help with patients' pain that may or may not be covered by insurance. So being well-versed on that, being able to explain to patients that, hey, this is what it costs. I think sometimes we kind of shy away from talking about money from patients.
Yeah.
It's uncomfortable. But you look at the plastic surgeon around the corner who just has a menu, $5,000 for this, $10,000 for this, and it kind of is what it is. So I do think that we've got a tremendous future ahead of us. It's just adequate preparation and how can you benefit more from the office with those types of procedures and settings that you're currently doing.
Yeah, that's nice. What are there a couple of MIS procedures that you like? Just a couple of your favorite in the office that you like to do?
So the in-office procedure, I'm a big fan of like hammer toe repairs. I'll do partial amputations and such. I've started to toy. I'm going to go to a conference later this year about, MIS bunionectomies and such. I currently do those now in the operating room with internal fixation, but I've got a colleague in California who's doing some really fantastic things, MIS in her office, and I'm just blown away by her pre and post-op pics. So I'm going to probably fly out to California later this year to see her and then attend a conference and see if that's something we can employ in our practice.
Yeah. And, for those that are listening, it's about knowledge. So however, you're not going to learn it just watching a webinar. You have to go to a conference. You have to go to see a friend that's doing it. Like my favorite thing, and I just have regular medical students come through my office and I just love talking. And so like visiting other doctors' office in California or another state or in the same town, like if you have a half day, do that. That's what inspired me to go into private practice. I shadowed as a resident, all the doctors. And, you pick some from, but the problem is once we start in practice 10, 15 years, you don't have that opportunity anymore. So kind of reinvigorating that and visiting other people. Like I'd love it if you came out to Massachusetts or if I ever ended up in Louisiana, take a half day and meet, because most people are willing. You have little tips that you can share like you're sharing here today. So.
No, it's such a cool profession, and owning your own business and practice is it stressful? Yeah. I mean, are there more things you gotta worry about? But heavy is the head that wears the crown, as they say. And it's nice to be your own boss and determine each and every aspect and facet of your practice. I think that's just such a unique thing. And a lot of the employed physicians that I'm friends with just don't have that benefit or luxury.
Yeah, great. Well, Daniel, I think we covered a lot of good tips for people, especially this part about like doing a secret shopper and then the collagen and some things like that, and getting a consultant, so I'm sure the consultant would love it if you said who it was. If you feel comfortable, you can say their name. It's up to you.
Yeah, it's Miss Holly Berkman with Berkman Consulting. She is absolutely fantastic. I recommend her to everyone.
Cool. Well, great, Dr. Hall. Thank you so much for your time. I appreciate it.
No, Don, thanks for having me. I appreciate the opportunity.